How do you find a therapist that's appropriate for you?
Well, that's a good question. Hiring a therapist is not like hiring a painter. You can't drive around and say, look at the good job they did on this house, they cleaned up after themselves, they were there on time. It's a little bit different. The therapist that a first responder picks should fit well with them. They should have what's called cultural competence. They should get it. You don't want a therapist who cannot handle the traumatic events of your incident and your work life. You don't want a therapist who is going to cry when you are talking about the death of a child, for example. You need a therapist that fits with your personality and your style. And every therapist is different. So if you meet one and you don't like them, give them a chance for a while. But if they don't get it, then it's time to shop around. You might ask for a recommendation from somebody, one of your colleagues. The list that your department provides on the insurance will tell you what therapists accept your insurance, not necessarily what type of therapist is a good fit for you.
Anything else we want to be looking for when we choose a therapist?
You want the therapist to be licensed in your state. That ensures a certain level of competence and quality. So you want a therapist that has been licensed. You want a therapist with some experience in your difficulty. Let's say you have an alcohol problem or a drug problem in addition to some work difficulties. You'd want an experienced therapist in addictions. Or perhaps you're having some marital problems. You'd like a counselor or a psychologist that has some experience treating couples. Another thing to consider is the therapist's experience with that particular type of trauma. A therapist might have experience working with sexual assault victims, for example. And if you're working with sexual assault victims, that's a different type of trauma than the critical incidents that first responders are exposed to, involved with in their jobs. You want to look for a therapist that has experience in trauma, specifically the job-related traumas that first responders experience.
What about the notion that no one can treat a firefighter or a police officer or an EMT unless they've been a firefighter or a police officer or an EMT? Is that a necessity?
Well, that's a personal decision for the first responder. The first responder gets to pick their therapist. And if that's important to him or her, then that's a fine criteria to have. Certainly there are a few psychologists who have also been a police officer, who also have been a firefighter. What I tell the veterans that I work with is, I haven't been to Iraq. Is it important for you that I have been to Iraq, or that I have a map to get you out of where you currently are? Along the same lines, some people with drinking problems think that only an alcoholic can help them because only an alcoholic would understand substance abuse. And that is certainly a very personal decision for that first responder or for that alcoholic or addict. And if that's important to that person, that their therapist be addicted themselves or in recovery from addiction themselves, then that's certainly a personal decision that I would respect from a first responder.
There seems to be all kinds of people in the therapy field. I mean, you see different titles and different letters after people's names. How do we know which of those is appropriate for a problem that a first responder might be having after a critical incident?
Very good question. Most people are often confused by the difference between a psychiatrist, a psychologist, a counselor, a therapist, a social worker. So that's a great place to start. A psychiatrist is a medical doctor, a physician basically, who can prescribe medication for emotional difficulties. For depression, a psychiatrist might prescribe an antidepressant. A psychologist is also a doctor, but not a medical doctor, not a physician. Psychologists in most states cannot prescribe medications, so the way they would treat depression would be through therapy. Counselors, therapists are all general terms for people that do counseling. A master's level person can perform therapy. A psychologist can perform therapy. A psychologist can counsel people. A therapist can counsel people. Counseling and therapy are interchangeable, basically. So you can call a counselor a therapist or counselor. You can call a psychologist a counselor or a therapist. But you can't call a therapist or a counselor who is a master's level person a psychologist. Psychologists are doctors. The way to tell if a person is right for you is how you want to approach the problem. Some people avoid medication. They don't want to take medication for their difficulty. So there's no need to see a psychiatrist first for that type of individual. You might start off with a therapist at the master's level, and if you feel comfortable with them and you're able to make changes, if you feel better, if you're acting different and feeling good, stick with that person. If you feel like that therapist does not get it, is not culturally competent, then find somebody else. Ask for a referral. A psychologist is a doctor. You don't need to have a doctorate to do therapy, so it's really a personal decision. What I mean by cultural competence is, does the counselor that you're seeing get it? When you describe how the brains and the blood were splattered all over the wall, do they react or can they hold that type of trauma? When you talk about your shift work or your sleep difficulties that's job related, do they understand that? If you're not seeing a medical doctor and you need medication, a psychologist or a therapist, certainly a master's level therapist, can't prescribe in most states. So the psychologist you're seeing